Great. Good morning. Welcome, everybody. Thanks for joining us. I'm Jeremy Lewis, Executive Director of the Street Collective. We're a community-based nonprofit organization that champions active transportation options that are safe, accessible, and enjoyable for everyone. We do this work through various community initiatives like our employer programs, bike giveaways, outreach and education, as well as our recent bike share expansion. Every day we strive for a healthier, safer, and more sustainable Des Moines. We're here in front of Brody School Park, next to the middle school, in a residential neighborhood, and a dart stop. This is one small piece of Des Moines' 180 miles of Priority 1 sidewalk gaps, which will take more than 20 years to fill. That's 20 more years of children have to walk on the streets to get to school. 20 more years of bus stops that are inaccessible to people with mobility devices. 20 more years that stretches are impassable when it snows. 20 more years, this is in every ward, in every neighborhood in Des Moines. 20 more years is too long to wait for safe spaces to walk. We must eliminate these gaps faster and connect people and neighborhoods throughout our city. We're calling for the City of Des Moines to accelerate this timeline and fill in all Priority 1 gaps in 10 years. We're excited to be joined today with AARP State Director Brad Anderson, Stacy Freyland, Regional Team Lead of the American Heart Association, Ward 3 Council Member Josh Mandelbaum. Also in attendance, I'd like to point out a few people. Thank you for joining us. At-large Councilman Carl Voss, Aaron Hockman from DART, Tom Calvin from Tom Calvin from ARL. Again, thank you for joining us today. I'll turn it over now to Brad.
All right. Well, thank you, Jeremy, and thank you all for being here today. So for the last 17 months, I've been working out of my home office in Des Moines, and my home office overlooks a sidewalk. And one thing I've noticed is there are more people than ever walking. And I've noticed this, starting in March of 2020, but certainly over the course of the summer. But then the remarkable thing was it even continued in the winter. So there were people walking that I never seen before in my neighborhood that were now walking the streets. And so they're walking their dogs, they were walking to help people during the derecho. So I have witnessed firsthand this renaissance in Iowa, and I think that's happening in America in terms of more people than ever walking. And so it's important that we provide them the tools that they need to continue walking moving forward, and those tools include sidewalks. And so one of the things that we did at AARP was we conducted a statewide survey in January of this year. And that survey included 2,300 Iowans from across the state in all 99 counties. And it asked them a series of questions. And these were Iowans who were over the age of 50. And one of the questions was, are you getting outside more? Well, of the people that answered the survey, 50% said yes, they are getting outside more because of COVID. So then we asked, well, you're getting outside more. Well, what are you doing? What are you doing outside? And the results were really interesting. So 2% said they're bird watching. So I thought that was interesting. 2% more people bird watching. 4% said biking, Jeremy. So we got some more bikers. 17% said gardening. So gardening was really popular. 50% said walking. And there were a number of other things that were mentioned that got 1 or less percent, but 50% of the respondents said walking. And so it is just really important that we embrace the people that have taken up walking and kind of fostered that and allowed them to do more so down the road. So right now we have a golden opportunity in front of us. We've got more people than ever walking. We've got city council members and a city staff who are engaged in this issue and willing to work with us. We've got potential federal funding in terms of infrastructure dollars coming down the road. And the more that we have a plan in place to capture those dollars, the more likely we're going to bring those dollars to Des Moines. And finally, we have organizations like ourselves willing to help. And so this is a truly historic investment in walking in Des Moines, and we are very proud to be a part of it. And let's continue fostering what we believe is this renaissance in walking in Iowa. So with that, I'm going to turn it over to Stacy Freeland with the American Heart Association.
Well, thank you all for letting me speak today. I'm representing the American Heart Association, and we really firmly believe that we want to have a world of longer, healthier lives, and we want to ensure equitable health for all of our communities. We are collaborating with these organizations and have been for some time because we really feel everyone deserves to live in a safe and healthy community. Des Moines has an opportunity to make it safe for people to share the road with cars and trucks. Sidewalks connect to parks, just like the one that's right behind us, and everyone should have that access. It's really important, and it brings a lot of opportunities for people to become active in their community. We also want to make sure that people are feeling connected to their neighbors, and if we are able to bring sidewalks and connectors to sidewalks, that makes people feel a lot more healthy, and their well-being overall is impacted. It's really interesting how we have seen this huge uptick, as Brad had mentioned, of people using a lot of our trails and our sidewalks. So many of our volunteers and staff have noticed the challenges in areas that need a lot more improvement here in this time while we have dealt with COVID. So it is one of the things that we are very passionate about, is really getting that connectivity of sidewalks within Des Moines. People, with moms with strollers and people who are disabled, they also need that access, because it's really impossible to try to get a wheelchair down a street and across to a park especially if it's a child trying to get to school. So the same neighborhoods that we see a lot of issues when it comes to getting access to sidewalks are often communities of color and low-income neighborhoods. And they often are the ones that have a lot of chronic diseases like heart disease and diabetes. So the more opportunities we give to people in those communities to have access to healthier opportunities is how we can make their lives healthier overall. I hope that the City Council, and including Josh Mandelbaum, who I'll bring up here in a second, will really seriously consider making the stride towards closing these gaps with sidewalks within Des Moines, and we hope you'll support that. What? Oh, Tom is next. I'm so sorry. So I'll bring up Tom next with AARL and let him share his thoughts.
Thank you very much. I'm Tom Colvin. I'm CEO of the Animal Rescue League of Iowa, and I'd like to speak today on behalf of pet owners. Now, we learned some interesting statistics here today. One of those is that 50% of the people that were surveyed actually have increased their walking. Something else they did during the pandemic is they adopted pets, which was really a great thing for us. But people did that for a number of reasons, and they realized the value that pets can bring to their life. Pets are healthier, make you actually healthier. They lower blood pressure, they allow you to interact and have a social life. Any number of these types of things that make them health benefits for the people that adopt them. But the healthiness also has to come with sidewalks. Getting those pets out, walking them, but being safe doing that is critically important. And as you've seen around the community, people will attempt to walk their dogs even when there aren't sidewalks, and that just simply is not safe. It's not safe for the pet, and it's certainly not safe for the pet owner as well. So we're firmly behind this whole project of getting sidewalks interconnected with where they may be going to dog parks, and other places around the community that are becoming more and more pet friendly. And it's those sidewalks that are going to keep people safe getting through. So additional benefits of actually having a dog is it helps fight loneliness. We know so many people were dealing with that and are dealing with that from the pandemic. just the idea of having a pet friend is just critical. And people in the community of Des Moines, we estimate that there are 55,000 dogs living in the community of Des Moines, and they need a place to exercise, a place to walk and walk safely. So we're firmly behind and glad to join this effort, and certainly look forward to seeing this project done as expediently as possible. So we appreciate the opportunity to join in today. And next I'd like to invite Councilperson Josh Mandelbaum to come up and share his thoughts.
Great. Well, I want to start out by thanking everyone for being here today, particularly the Street Collective, AARP, the Heart Association, and Animal Rescue League for being partners in this event and in this call to action. I wanted to thank AARP, the Street Collective, American Heart Association, and Animal Rescue League for being partners in this call to action. I wanted to also thank my colleagues on the council for supporting investments in our sidewalks, what we've done to date, and what we hope to do going forward. I wanted to start by talking about this specific location and how it fits with what the city has done and what the city can do and is doing. We are sitting here in a Priority 1 sidewalk gap, which is just a couple blocks from a major corridor in our street that has transit access, it has amenities. One of our signature parks in Gray's Lake is just a short walk away if it is safe. We're close to grocery stores and shopping. We're close to amenities like grocery stores and shopping and restaurants. All of that can be accessible if we make it so. And the city has a great plan to do this. With a number of the organizations and folks who are here, we passed our first transportation master plan, Move DSM, just a few years ago. And as everyone knows, a plan is only as good as its implementation. We're seeing a piece of that implementation with what we're doing on Fleur Drive and the reconstruction there. We're adding sidewalks along a major corridor that has existed in our community that hasn't had sidewalks for years. That's going to make that corridor more accessible. It's going to make that corridor safer. It's going to make it a better corridor for transit. Those type of investments take the plan into action. And that's another piece of why we're here. Because also in that plan, we identified 180 miles of Priority 1 sidewalk gaps. Gaps between schools like Brody Middle School behind us, or gaps between transit stops. What we need to make it safer, make our community safer and more accessible. And our plan is only as good as our action on it. And we've made that initial commitment. We've been funding $3 million a year in addressing Priority 1 sidewalk gaps. That's gaps like the one we are at between Fleur Drive and Brody Middle School and Brody Park. But we know at the pace that we are going, for our plan to become a reality, it's going to take another 20 years. And that's too long, because that leaves gaps all over our community. And particularly, part of why we are here, the south side in our community, in my ward, in Councilmember Gatto's ward, have more gaps than other parts of our community. And we think it is too long to wait for this solution. And that's why I'm glad to be here with folks calling for us to accelerate our investment, calling for us to close these gaps within 10 years. If we do that, we'll make our community more accessible. If we do that, we'll provide a mobility solution for thousands in our community. If we close these sidewalk gaps, we will make our community safer. We'll also make our community healthier and more equitable and more sustainable. That's why the time to act is now. And we've got a great opportunity to do so because we have funding that's coming into our community from the American Rescue Plan, from the pending infrastructure investment at the federal level. Those are the types of places that we can look to provide dollars to speed up this investment. We must act, we can act, and we can make our plan a reality. Thanks to everyone here.
Any questions? I think we're